Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back. Today we are talking about wisdom teeth extractions and specifically what to do the week after you've had your wisdom teeth out. That's one of the most common questions that we get asked.
A lot of people want to know that, what to do right after, especially the first few days after, because seems to be like your whole mouth is all messed up. You can't bite, you can't eat. So what are you supposed to do? So number one tip is ice it right away. First few hours, icing it, because you're really trying to decrease inflammation. It's all about the inflammatory process and trying to decrease that as much as you can in the first few days so that it decreases the pain. So icing is a key thing you can do.
So one of the questions that we get a lot of is, what am I allowed to do and what am I not allowed to do right after wisdom teeth extractions? So what is the recommendation for the average person that has their wisdom teeth out?
So I'm sure every dentist and doctor says this, but do not smoke. Smoking can inhibit the blood flow, which can really, really decrease the healing process and can actually create more issues like dry socket and infection. So no smoking of any kind, no vaping, no pot, no any kind of smoking, at least for 2 weeks. I mean, we like to see you never smoke ever, but at least the first 2 weeks is really crucial. Because that can not only stop you from healing, but it can introduce a host of other issues that now your body has to deal with.
So let's be realistic. For someone who is a smoker, stopping for 2 weeks is nearly impossible.
That's true.
What is the minimum amount of time, that crucial window where they really should avoid it?
We talk about alternatives to smoking.
Okay.
So if you really, really cannot go without a cigarette, maybe you can try patches or gums or some other way other than just the actual smoke entering your mouth. That's really, really the bad thing, because the actual smoke entering your mouth is what makes those blood vessels not flow and create all those issues.
So you mentioned a complication being dry socket. So what exactly is that?
So dry socket is exactly kind of like what it sounds like, because in actuality, the body is full of blood vessels, saliva. So it's like a very moist and wet environment. And we do want to see bleeding, believe it or not. We do want to see, when we take out a tooth and there's a hole there, we want to see it fill with blood. That's a blood clot, and we want that. So dry socket is when we look in that hole and all we see is the bone. There's no blood, there's nothing. And that's extremely painful, because your body literally cannot get enough blood in there to fill that socket with blood, which is the first step towards it healing and filling it with bone and gums and all that.
You can think of it like getting a scab. Like if you cut yourself on the skin, what happens is you get a scab on there. If you peel that scab off, then the tissue is raw again, and the bleeding process starts. So the blood
clot is like that scab. So it's like as if you're just have this raw bone with no protection. It's extremely painful, and it can be one of the things that is caused from smoking after. Yeah.
Okay, so we talked about smoking at 2 weeks if possible.
Yes, please.
What are the other sort of more immediate things you should do? So you have your wisdom teeth out, you go home.
Right.
What are you doing next?
So first thing is you're icing it, and you're probably numb. So ice, soft food, soft diet. And we just talk about having a smooth diet, like mashed potatoes, broths, really nothing chunky, because again, you have these holes in your jaw, right? So you don't want stuff to get in there, especially for the first 24 to 48 hours. So soft, smooth diet, no smoking, icing it. And from there, you just want to be, just normal, realistic about, you had a surgery, now you're healing. So Give your body rest. Don't go do a heavy workout. Don't, go to like a function and give a speech. Like, just be kind of reasonable with your own healing process. You're trying to heal from something. So obviously take your medications, antibiotics and pain medication that you were given as well. So just common sense stuff is
So
the main
no heavy
thing.
lifting, no running marathons.
No marathons.
Just hang out at home and have soup and mashed potatoes.
Exactly. Just give your body a chance to heal.
Okay.
Don't introduce any foreign objects in there, like, chunks of peanuts or whatever. And then no smoking.
So you mentioned medications. What are the typical medications that are prescribed after wisdom teeth extraction?
So I would say the typical ones are antibiotics and pain medication. Sometimes dentists or surgeons will also give you some extra anti-inflammatory like steroids just to help again with that swelling. As far as if you are on any medications like for high blood pressure, you should continue to take those normally. We don't want you to stop your other medications. The only exception can be if you're on blood thinners.
Sure.
So if you're someone who's on blood thinners and you had a surgery, your surgeon, your dentist, and your medical doctor should coordinate as to when you should stop taking those blood thinners and when you should get back on them. So that needs to be coordinated before your surgery, because obviously you don't want to, have like uncontrolled bleeding. But other than blood thinners, you pretty much have to continue taking all your medications normally, plus whatever your dentist has given you, which is normally antibiotics and pain medication.
Okay. So blood thinners, don't get off of them on your own. Make
No.
sure that your dentist has consulted with
That's
your
right.
medical doctor to figure out what's most safe for you to do.
That's right. You want to make sure that you're maybe getting, sometimes you don't get off of them. It just depends. So maybe they have you get off of them a few days before, one day after, or maybe not at all. So that needs to be in consultation.
Okay.
Yeah.
And so when you leave after your extraction, what do you look like?
You look normal. You
Okay.
look pretty normal, right? The inflammatory process is not something that just kicks in like a switch, right? It takes a few days for your body to build up. So the first day you're looking good, you're feeling good, you're like, I'm good, And it's normally by the third or fourth day when you start to really feel the pain and you start to be more swollen. And that's completely normal. It's like a wave, like you get swollen and then it goes away. So, that's why we tell people, please take your pain medications for the first 4 days, no matter what, because you're not going to feel the full effect until a few days after the surgery.
And then if you're on the pain medications, it kind of covers you and lowers the pain that you might potentially have if you're not on anything.
That's
to
right.
begin
Yeah,
with.
yeah.
Very good. And then what about bruising and swelling in day 3, 4?
So it's the same thing. Bruising can happen. It can happen all along your jaw. Even your eyes can get bruised. And really depending on your complexion, obviously, if you have like a very light complexion, you're more likely to get bruising. But again, that's just part of the inflammatory process. So take it with a grain of salt. Use makeup if you need to for a few days, but it should go away just like the swelling goes away. So it goes through its own wave and then your body just absorbs it.
And we should say that not everybody gets bruised.
No,
it's
most
not
people
a
don't.
common thing, actually,
No,
but it can happen.
It can happen, but it's not, most people don't. Yeah.
Okay.
Most people don't. The other things I want to mention is kind of like, okay, we got through the first few days, so no smoking, icing it, smooth foods. After day 4, you can start to, have a more normal diet. And then you need to just keep the area very clean, right? So it's still not completely healed, so you just want to be flushing it back there. We give everyone a syringe so you can flush. And you just want to keep it clean, continue taking your medications, continue to be reasonable with your body as far as healing. But after day 4, you can kind of like start getting back into normal
stuff.
foods and
Okay. And then you talked about cleaning the area. So we hand out a syringe. It's called a monojet. And what do you recommend that people flush the areas out with? Just regular water?
Just regular water, no fancy mouthwashes or anything, just
Good.
normal water.
What about a little salt?
It's
Salt
okay
water?
if you want to add a little salt, but
Okay.
You don't have to. Yeah.
And what should you avoid with regards to mouthwashes and things like that?
A lot of mouthwashes out there have alcohol in them, and we don't like that at all because it tends to just dry out your mouth. It does give you that feeling of like that fresh feeling, but that's just, because it's alcohol.
So we should say that mouthwashes in general that have alcohol are not good for anybody. No one should be using them at all.
Using them at all for anything at all. But specifically for this too, don't use anything that has alcohol in it. So there are mouthwashes that don't have alcohol. There's a brand that we like. It's called ACT, A-C-T.
Yep.
And it even has extra fluoride, so for daily use, you can use that. But again, for this purpose of this wisdom teeth, you don't have to use any mouthwash. You can just use regular water. Yeah.
Perfect.
Yeah.
So first couple of days, kind of leave it alone and then start rinsing with the mouthwash?
Yes.
Or what is the recommendation?
Yes, after day 4.
Or with the, not mouthwash, with the
with
non-gel.
anything, yeah.
Okay.
Okay, another common thing that I get is the first 24 hours, you might see bleeding or some oozing. You might see blood. It's normal, okay? It's not closed yet. It's a wound. So as soon as you move your jaw a little bit or if you bite on something, it's going to just ooze a little bit. So what you need to do is you need to get some gauze, put it back there, bite down, keep pressure on it for 15 minutes, and then remove the gauze. If it's totally good, you're good. If it starts oozing again, do the gauze again. So for the first 24 hours, a little bit of bleeding is normal. So sometimes people freak out when they see some blood, but that's just, it's a cut. You have a big cut back there, so it might bleed a little bit. Yeah.
And it's a good point that when you put the gauze in, you want to apply pressure for a good 15 minutes, not to keep removing the gauze every few minutes. Why is that?
Again, we're trying to create a blood clot, right? So imagine if you cut yourself and it's clotting and you keep wiping it and wiping it. It's never going to have a chance to clot. So we want the same thing in the mouth, so we want to just leave it alone, keep pressure on it. Don't tug your cheek and look back there. Don't mess around with it.
Don't
just
poke it with a toothpick.
Let it be. So, yeah, it's very simple and common sense stuff, just like any other cut in any other part of your body.
So after somebody leaves here and they've had their wisdom teeth out, they have already picked up their prescriptions.
Yes.
So important that we'll give you your prescriptions ahead of time. You can pick them up so you're not going to the pharmacy after your wisdom teeth extractions, right?
Right.
So you're going home, your medications are there, you have some soup in the fridge ready to go.
Be ready.
And your meds with you.
That's right. And hopefully somebody there to take care of you.
Okay, let's talk about that.
Okay, so with sedation, especially if you're sedated and you leave here, you're not fully back with it. So you definitely need somebody there with you, at least for the first few hours, to make sure you're okay, you're getting something to eat, you got your medications.
And in fact, we want somebody to be picking you up. We're not going to let you walk out of here after a sedation procedure on your own or in an Uber. You need to have somebody that cares about you take you home.
Yeah, you need somebody there, especially with sedation, but just generally with any surgery, I would say.
Exactly.
It's nice to have somebody there after just to help you for the first few hours.
Got it. Okay. Yeah. And then, so let's talk about sutures.
Okay.
So usually when you're removing wisdom teeth, you're going to apply some sutures.
Yes.
What does that look like and what is the care for that?
So, sutures are normally resorbable. I would say 99% of the time they will fall out on their own. The care for that is the same. Do not tug and poke at them. Let the suture do what the suture is supposed to do, which is to hold the two pieces of tissue together. If you keep yanking it, it's going to break and then things are going to open up, which we don't want. So just leave it alone. It can be a little annoying, but basically just leave it alone.
So then we'll have you come back in to see us about 2 weeks later after your extraction.
We usually see you about 2 weeks later. We remove any sutures, answer any questions, and it's normally just like a check-in to make sure everything's healing okay. But I hope that answered most questions about what to do after your wisdom teeth extractions. Thank you for tuning in, and we look forward to seeing you on the next episode.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.